Day 24. Day 25. Day 26. Getting there. Ish. Day 27. I think. Day 28. Getting there. It's Friday, which, as we say every week, doesn't really matter when you do it 7 days a week, but...
That was your last Friday of chemo for this round.
That's true. That's something for this round of chemo anyway. The long one.
Happy Friday!
Yeah, it is Friday. Yeah.
Wasn't the greatest week, wasn't the worst week. And it's the last Friday you're doing chemo this round.
Yeah.
Yeah, you only have 3 more days or 4 more days for me to pour for beginning of next week.
And that is a nice small victory, you know, to be at that position that we're almost done with the first round of chemo.
Yep. It's the unknowns this week that got both of us.
Got it, you know, I'm trying to remember everything even.
The first thing was on blood work day. You found out there's blood work standing orders through the end of the year.
Which is a long time. When you think, for 6 weeks I have to go every single Tuesday and get a blood draw. Well, that's not fun. And
then you found out that it doesn't end at the end of the 6 weeks.
Right.
That's so long as you're going to be on chemo, they're going to be checking it. Which means from now until eternity, as far as we're concerned, we don't know what you're going to be doing.
Right.
And we thought you were going to be able to get rid of the antibiotic you're on because you're finishing chemo. Nope. Even during the off times, you stay on the antibiotic. So,
and she said for how long?
For as long as you're going to be on a chemo regimen.
But that's, from what we understand, that's essentially my life.
No, up to a year.
Well, I'm sorry.
6 months to a year, after this.
But
I thought you took the antibiotic while you were taking the chemo. No, it's all during, not just while you're taking the pill. Which, that's really confusing if you read pill bottles. Because it says, while being treated with chemo. I would think that's the days you're taking chemo pills. So again, we're not, underinformed people, yet the communication is very confusing. So it's like, you're informed, you ask the questions you're supposed to, and you walk away realizing you don't get answers. And this sounds minimal when we talk about it, but we made it a point to be proactive on Tuesday.
Very.
We asked, radiation, we know what the last day is. We were talking to them about the chemo ending and what day that is and where the blood work's falling.
The continuous arc here is that it always goes back to, if we didn't ask, how do we know this was a thing? How did I know that this week I was going to do a realignment of the laser to a different position? Twice this week, I went in through all the process, but didn't actually even get a treatment of the radiation, which is weird, because there was the day where they realigned me. Yeah, so I only got to actually do 1 day of the new, the more refined radiation points. That was yesterday, and then today, I was doing a new treatment, and then I have 2 days off because of the weekend. It's it's weird that they don't. I mean, I guess because I started on an off day of the week.
Mm-hmm. That's not even as frustrating as trying to coordinate with the doctors that you're not seeing to get back in with them, which is the oncologist at Moffitt when you go back. It's going to be between Thanksgiving and Christmas. We're trying to be proactive about it. And they keep throwing us curveballs of things. We're like, had we not been having this discussion, you wouldn't have mentioned that to us.
Yeah, that is I can't even explain how frustrating it is that we are just constantly... How are we even known to ask this question?
The prime example, I almost want to go in the other room and get the bottle to read the directions on camera, which I think I'm going to do. Hang tight for a minute. Movie magic, you didn't even know I just left the sofa to get this. But what I wanted to read, and I want to share this with you, Ed. Take 1 tablet by mouth, 1 time daily, for PCP prophylaxis while on chemotherapy. when you stop chemotherapy next week, I would stop this. So I asked, do you stop it the same day? Is there a couple of days later that you should stop it? And she says, no, you're going to take it for the next 6 months to a year while you're on chemo. And I'm thinking to myself, well, we haven't determined if you're going to be on chemo for 6 months, 8 months, a year. So you're not on chemo once you're done with this round of chemo. That is very confusing. Had I not asked how to end this, I never would have found out you're not supposed to, but you will not be on chemo for almost 6 weeks. How do you know these things?
Honestly, I don't know, because I do know that if we call, or if we ask some of the other doctors and nurses we've interacted with at both centers, we end up getting a couple different answers.
Oh, flu shot.
Oh, yeah.
So in doing all of this, we were just talking about, what will your immunocompromisation look like as you're finishing radiation, finishing this round of chemo. And they kind of made a nonchalant comment, well, as long as you got your flu shot. I'm like, wait a minute. You said he couldn't get his flu shot.
Right.
What are you talking about? Well, all the oncologists here give the flu shots to the patients. No, we specifically asked, and we're told he shouldn't have a flu shot.
Very clearly. In fact, I'm sure we have camera footage
where we were talking about
how much I always got a flu shot because I worked in schools. I understand.
So I got it, and I had to check that it was okay to be around Ed. What do you mean, why didn't we get a flu shot? And those are exactly the types of things.
Yeah. It is a constant confusing journey of this person says this person, but then sometimes I feel like even the same person says a different thing at different times.
Yep.
And to be fair, they have a million patients, and I respect that, and I know that they cannot know everything about everything in your chart, even though that's a lot.
Yeah, but when they have a portal, or when I'm taking the time to itemize a question to the call center for them to pass along, where I'm not barraging them, they have time to formulate an answer. I am sorry. Also, come to think of it, this is going to be a venting vlog for a moment, because we didn't really recap this week because it was lots of just little things that seemed minor. You have been having like some muscle pain and some nerve things, and I put a message into them yesterday.
Yeah.
No, the day before. They got back to me saying they were forwarding it to the doctor. Okay, usually the nursing team is the team I sent it to. Didn't get an answer. Called today to say I didn't get an answer. Your surgeon's nurse, we're not being observed by the surgeon right now. The surgeon's nurse calls me back, confused as to why I'm asking these questions. She addressed them for us to the best of her capability, but then said, I'm going to send this over to oncology. We've now entered the weekend. We haven't heard back from them. I started this Wednesday. It's just that kind of stuff.
Yeah. And I don't know if we expect more, but we don't have crazy questions. We don't ask every little stupid thing. We pay attention to what we are told so that we don't have to repeat it. And then you just randomly get the things like that, or you get why would you not take your flu shot? I would.
I think I expect a moment of pause from them to actually formulate an answer and not just off the cuff respond.
You're right, because you're not on the phone. It is in a portal.
Yes, you have a moment to think before you respond to me. Look at the patient, look at the demographics, look at you as a picture instead of chart number whatever. I don't know. And that was, I think, if for those of you who follow us on Instagram, that was a lot of what we were posting in our daily reflection posts. We really were starting to feel like just a cog in the wheel as you reach the days of the higher 20s in your radiation. You're neither here nor there. Your chemo's finishing up, but you're not going back to the oncologist yet. You just kind of feel like you're floating out there and you're just one of the statistics.
Yeah. It is, that is the sad reality. That is a lot of how you feel. And it's not that any of the professionals are doing anything wrong. The system, I think, is probably bogging them down, but
and they don't have a chance to remember you as a patient.
Right.
Yeah.
Yeah.
Well, we did get through some good stuff this week, too. I mean, you got out to see Christmas in the theme parks yesterday.
Yeah.
Look at that smile, though.
Yeah.
You got your fancy little hat yesterday.
Yeah, so we were trying to stay busy and have fun as much as we can, you know, because without getting back into the cycle of be in a bubble, don't be in a bubble, wear a mask, you don't need a mask, you know. We're trying to play that by ear and judge as much as best we can.
When you're feeling good, you do what you can. When you're not feeling good, you stay home. So the week started, you know, you were feeling okay. Middle of the week kind of slumped down a little bit.
Yeah.
Then yesterday we went out again. And this weekend we'll see how it comes.
But then tonight, not happening. So, you know.
Yep.
But that's
We're staying in tonight.
which is sometimes nice.
We have lots of new TV shows
That's
to watch.
true. So we'll be fine.
Yeah.
Yeah.
This is the last vlog with a full week of chemotherapy.
And then a whole...
And then next week will be the last vlog with a full week of radiation, because you will finish radiation at the beginning of the following week. Also, a little tidbit, for all the days in these 20-something now where you've been like, I don't know why I do this, I don't know why I push, it seems like it'll be forever and ever, you're getting to those little success points. You're getting to finish chemo round 1. Finish radiation. Let's not look at this as round 1. Look at this
It is,
but you finished that.
Okay.
We'll be wrapping this up.
All right. Fair enough.
Have a great weekend, everybody.
Good night. Thank you, guys.